Hello and welcome to my channel Pharmacy in Depth, where we'll talk about pharmacy related topics in detail. Today we will see what is hypertension and we will try to understand the basis of classification of anti-hypertensive drugs. Hypertension is a condition when the systolic pressure is equal to or more than 140 and the diastolic pressure is equal to or more than 90 mmHg. The blood pressure is a result of cardiac output into TPR, which is the total peripheral resistance. Cardiac output is the amount of blood which is pumped by the heart, and the TPR is the resistance which is offered by the blood vessels of the body. During hypertension, the blood pressure of the body is increased. That means either the cardiac output is increased or the total peripheral resistance is high. So cardiac output is increased in two cases. First is when the heart rate is increased, and the second is when the blood volume is increased. TPR is high when there is narrowing of the blood vessel, either by vasoconstriction or by deposition of plaque in the lumen of the blood vessel. It is similar to when we squeeze the watering pipe and we see that the water flows with high pressure from it. Now let's see some physicochemical reasons why this cardiac output and TPR is increased in our body. From brain, a neurotransmitter noradrenaline is released, which binds to beta receptor present on the heart and increases the heart rate. This noradrenaline also binds to alpha receptor present on the blood vessels, leading to vasoconstriction. This increases the TPR. There is another system in the body which is called renin-angiotensin-aldosterone system or RAS system, in which renin is released from the kidney. This renin converts angiotensinogen to angiotensin 1, which is acted upon by angiotensin converting enzyme and converts angiotensin 1 to angiotensin 2. Angiotensin 2 itself causes vasoconstriction, increasing the TPR, but also leads to secretion of aldosterone, which causes water resorption, which increases the blood volume. Both these conditions leads to increase in the blood pressure. So based on understanding of these mechanisms, there are various drugs which act as antihypertensive drugs. So first we have beta blockers, which blocks the beta receptors and decreases the heart rate. We have calcium channel blockers, which directly decreases the heart rate. We have alpha blockers and vasodilators, which decreases the total peripheral resistance. Then for RAS system, we have direct renin inhibitors, angiotensin converting enzyme inhibitors, and angiotensin receptor blockers. These all blocks the RAS system. And then we have diuretics, which increases the water and sodium excretion from the body, which in turn reduces the blood volume and hence the blood pressure of the body. Here you can see different drugs which comes under these classifications of antihypertensive drugs. So guys, this was a brief about understanding the basis of classification of antihypertensive drugs. Thanks for watching the video. I really hope you liked it, and if you did, like it, share it and subscribe to my channel.